Today we are going to discuss about central venous catheter. This is a typical 7 French adult central venous catheter and it is a triple lumen catheter, which means it has 3 ports and the ports are named as proximal, distal and medial. So first of all we are going to discuss with the distal port. This distal port, its tip open at the opening is at the tip of this catheter and it has close proximity to the heart. That's why it is used for CVP monitoring, blood transfusion, and also it can be used for fluid resuscitation. So, why it is used for these specific things? Because it will give an accurate measurement of CVP because it is near to the heart and it can handle high flow rate during the fluid resuscitation. That's why these port is commonly used for fluid resuscitation, CVP monitoring, and blood transfusion. Then the next one is medial port and it is of 18 gauge. So this one is specifically used for TPN administration. If your patient not have any TPN administration, you can use this for this port for the usual medications. So why this is specifically used for TPN administration? Because if your patient is on fluids or in fluid resuscitation and you can also give TPN. So if you are administered it through medial port, there is TPN have no interaction with these fluids. That's why we are administering TPN through the medial port. And the last and final one is proximal. Proximal is also of 18 gauge, which means medial and proximal are of same gauge. Then how you can identify medial from proximal? Because proximal is proximal to the site of insertion and it is very long because it open only near to the site of insertion and it is the most longest one in the longest one that we can visible outside. So that is the proximal port and proximal port is mainly used for blood sampling, medication administration and for infusions. We can use this for infusions, medication administration and blood sampling because it has an easy access to the blood. So we can use it for blood sampling. That's all about central venous catheter. I think all this is clear for you.